I'm Dr. Saleh from Ehrlich Animal Hospital, and today we're going to talk about how to give subcutaneous fluids to your cat. Now, an indication for subcutaneous fluids is usually cats that are dehydrated. Most commonly we're using it for cats that have kidney problems, and so if we can minimize the cat from being in the hospital and have you take them home and give them fluids at home, then that usually is better for everyone, and the cats tend to do better. So the procedure involves a bag of fluids, which we will set you up with, so you'll be going home with a bag like this, and then with a line. And sometimes the fluid will have a color in it if we decide to add, for example, vitamin B complex or some other electrolytes, so the color may change. But we will talk to you about that when you get the bag. Now the procedure involves, like I said, the line, and you can see the line right here, and then there's a needle that comes with it. You want to change the needle every single time before you give fluids. The way you do that is you hold the line and hold the needle and twist the needle right off the line. Okay? And you want to replace this every single time. Now the needle has a little cap on it. And you take the needle, hold it, and twist. The cap comes off. Okay? Then you put the needle on the line and you twist it on. It has to be tight so it doesn't come loose. Now you're ready to give the fluids. You want to hang the bag up, and I have Chrissy hold the bag right now. And the line has a little white clip on it that allows the fluid to run. So if I move this wheel up, you'll see roll the wheel up, that will start the flow of the fluid. And then when you push it all the way down, that stops the flow. Okay? Now what we're going to do is we're going to demonstrate on Junior, who has graciously volunteered, and we're going to insert the needle under the skin. And most cats tolerate this really well, but he may move a little bit when this happens. So you want to be all set up with your fluids hanging up, your needle ready before you start doing this. Insert the needle. Now you want to use a little bit of rubbing alcohol. I have some rubbing alcohol on the cotton ball. And I'm just going to wipe the area right here, and we all tend to give it right over the shoulder area. There's a lot of skin. You can see, move the skin around. Okay? So I'm going to wipe it, and then I'm just going to pick up the skin, and there's a little pocket right here. And we're going to put it right in there. So I'm going to get ready, take the cap off the needle. I'm going to lift the skin, and with the bevel up, you can see the needle's bevel is up. Okay? I'm going to insert it right into the skin, just like that, and you twitch it a little bit. Now when that is when that's done, you can let go of the needle and then start the flow by pushing this wheel up. And you can see up here, now it's starting to drip. You can see the fluid dripping. Okay? And once the needle comes out, I'll give you some more instructions on how much fluid and how to look at the lines. But you let the fluid run in, and we're going to just stop it now. So again, first thing, don't pull the needle out yet. Roll the wheel down. Sure that's it? And then just grab the needle, the tube, and slide it out and put your finger over the hole where the needle came out of. It may leak a little bit in this area, which is normal, but that usually stops. Okay? So put the cap back on the needle, and then I'd like to immediately take this off and put a new needle on for the next time. That way you know whenever you're ready to start, you always have a sterile needle. Okay? Good job, Junior. Did great. Okay, so let me show you a few things on the bag. These bags are a full liter. And you can see their marks, 1, 2, 3, and 4. So when the bag is hanging, and you open the line, from 3 to 4 would be 100. Be another 100. Typically you're giving a cat about 100 cc's to 150 at a time. So you can squeeze the bag. Let's say that if you had help and you could squeeze the bag to let the fluid run faster, that is not going to hurt your cat. But when you're done and you want to measure the lines, never squeeze. Just let it hang and then measure the lines. Okay? So that's basically it. After you're done, it's a good idea to, if there are additives in here, we're going to ask you to prevent light from coming in. So you keep it covered. You do not have to keep it in the refrigerator. Room temperature is fine. A lot of times when you keep it too cold, that can actually, it kind of stings them a little bit when it goes in. So room temperature is better.